Yes, you must be my 2 o'clock patient. Okay, yeah, you're a little early. That's totally fine. I don't have anyone scheduled ahead of you. Go ahead and take a seat and make yourself comfortable. Okay, so go ahead and just give me your name and date of birth so I can make sure I've got your chart pulled up. I gotta do some confirmation there. Okay. Date of birth. Perfect, thank you. Okay. Just a couple of questions here that I want to go over before we get started. I'm going to give you just like a brief summary of what we'll be doing today, just so you know what to expect as well, okay? All right. Any changes to medication? Okay. Any new health history that you need me to enter into your chart? Okay. And emergency contact? Okay, we do have somebody different. Let me get that updated. And insurance, who do you have here? Okay, that's the same. Cool. Okay, it looks like there is a couple of things here missing in your chart. What's your favorite animal? No, that's a typical medical question. Perfect. Your favorite color? Yeah, no, we ask all our patients those questions. Yeah, you've never been asked those at a medical office before? That's weird. Okay, and then I'm also gonna ask your favorite food. Perfect. Got your chart updated. So the first thing, or what we're going to be doing today, is taking a couple different measurements. We're also going to be performing a couple of different procedures. These procedures are typically painless. We don't usually have any sort of response or feedback that it's painful. So certainly let me know if at any point you feel uncomfortable or are feeling pain. I also just want to make sure you don't have any sensitivities or allergies, especially because we're going to be working in your face. And so I want to make sure that we don't have any reactions that we're not aware of. Okay. Sounds good. So the first thing I'm going to do is actually take some face measurements. We take several different measurements of your face. So I've got my measuring tape here. No, this is a traditional measuring tape. Yeah, all our patients use this. I'm gonna go from the corner of your eyebrow down to your smile line. Okay, and same on the other side. Perfect. Just document that. Okay, I'm gonna go eyebrow to eyebrow, the tips here. Perfect. And then the space in between your eyebrows. Perfect. I'm going to go from your eyebrow down to your chin. Same on the other side. Okay, your smile. Okay, smile big for me now. Yes, thank you. All right, I'm also going to measure the sides of your nose. From there to there. And the length of your nose. Perfect. Awesome. And then I'm also going to measure from your cheekbone, the top of your cheekbone here, over to the top of your cheekbone here. Perfect. The numbers, I'm not sure what you mean. Oh, the numbers on the measuring tape? We don't use numbers on our measuring tapes. No, we use like the little characters that are on there. Yeah, we measure based on the characters. Numbers. Your other doctors use numbered measuring tape. I'm not sure how that would work, but that's not how we do it here, so strange. All right, if you could turn to the side, I'm just going to measure from your ear down to your chin. Perfect. Same, and turn the other way. Thank you. eyebrows here. All right. Yeah, go ahead. I'm also going to measure your eyes. So eye to eye. Perfect. And then I'm also going to measure from your eyebrow to like your lower lash line. Great, thank you. Same on the other side here. Perfect. Okay. I think I've got all of those measurements in now. So I'm just going to go ahead and enter. You're able to measure the face. No unusual findings. Perfect. So next we're going to clean your face. And that's just so that I can kind of have like a blank canvas to work from. And I just want to make sure before I apply any sort of like additional tools, since the measuring tape wasn't actually touching you, I just want to make sure if I apply any tools, they're going to be sterile, and I want to make sure your skin's sterile. Okay? Yeah, no, this is the cleaner that we use. It's very like normal. It's made purely of eucalyptus leaves. It's watered down significantly so that we don't have like any sort of reactions to like the eucalyptus, and it's sealed. You can see here, this is a brand new bottle. And then we use these brand new sponges that we got to make sure to clean the face. So we usually dab first, and then we'll wipe away any excess dirt. Okay? Yeah, no, these are usual cotton balls. So I'm just gonna dab these in here. Make sure this is nice and saturated before I apply it to your skin. We might need to do a couple different applications. So I'm going to do your cheeks here and then your forehead. Again, I'm just applying and letting your skin absorb that cleaner. And then your chin and your nose. Yeah, both sides of your nose, on your cheek. Yeah, go ahead and turn this side and I'll get your ear. Okay, thank you. And your other ear. Good. And then I'm gonna have you tilt your chin back so I can get under your neck. Thanks. Perfect. Okay, perfect. Really like that. I'm just gonna apply a little bit more cleaner here. Good. And then I'm going to move in circular motions now to make sure we get that clean. On the cheeks, forehead. Good. Right along that hairline there. Down your nose. Around your lips. You can go like this. Perfect. Thank you. And your chin. And just around the overall face here. Just kind of around the edges. Make sure I didn't miss anything. Perfect. Tilt your chin. Thank you. Good job. Thanks. Okay. That looks great to me. Set this over here. So the next thing I'm going to do is just apply some pressure to your face and just make sure that we don't have any sensitive areas before I start any procedures, okay? So I'm just gonna tap, 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 tap. Any pressure up here, any uncomfortable sensations? Nothing, okay. I'm gonna slide it. Good. Anything? Okay, great. I'm gonna start down on your cheeks then. Tap, 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 tap. Yeah. Tap, tap, tap. Anything? Okay, again, I'm just gonna rub now. Any uncomfortableness? Nothing. Okay. Okay. Other side here. Okay. Perfect. Nothing? Great. That's great. Under your eyes here, I just want to make sure you don't have anything. No? Okay. And I'm going to go down your nose here. Your nose is a little harder, so I'm not going to tap very hard. Anything there? Great. And last but not least, on your chin, your chinny chin chin. Great. Perfect. Okay. that was easy. The next thing we're going to do is, typically what we do is we try to extract as much moisture from your skin as we can before we start the procedure. This is very common, and the moisture in your skin and your dermis are going to replenish very shortly. So anything that I take away will be replenished very shortly. If I noticed you had dry skin, then we would most definitely kind of skip this step. So I'm going to use this extracting tool. A charging port. No, this is an extraction tool. Yeah, you're so silly. So yes, I'm going to use this extraction tool to go ahead and pull out anything that looks like moisture. So start up here. Okay. Good. Yeah, that looks great. Down the nose. And the cheeks. And last but not least, your chin. Okay, that looks really good. And go ahead, I'm gonna get out my extraction or my injection tool. Again, this should not be painful at all. This is actually considered an injection that is non-surface, so it actually injects like not with a needle. It uses like advanced technology to just like almost like a UV ray kind of inject. So like this looks like a needle, but I assure you it is not a needle. No, this is an injection tool, not a pen. No. Okay, so I'm gonna go ahead and get this charged. Yeah, you just pull a cap on and off to charge it. Okay, so just gonna go ahead and inject some of our formulas here. And again, this is not a needle. This is like a UV tool that can just radiate the serum into your skin. Perfect. But if you do feel uncomfortable, feel any sort of sensation that doesn't feel normal, it shouldn't really feel like anything other than I'm like applying lotion to your face. So if it feels different than that, certainly let me know. Good. Awesome. Yeah, we're like halfway done already. Down the nose. Good. Yes. And across your chin. Awesome. This looks really good. I'm gonna charge this one more time, and we're gonna do just like a couple quick touch-ups in a couple areas. Okay. Yeah, just like there. Right there. Down here. That looks good. Okay. The last thing I'm gonna do is even though like we didn't do any sort of like injections or like nothing with like needles, you're not like bleeding or anything, but we still want to make sure your face is bandaged so it can like absorb fully all of the formulas that we've put onto your face. So we're just going to apply some of these band-aids. You're just full of questions about my tools today. No, I assure you these are band-aids. Yes, band-aids. So I'm just going to apply a couple here. Put some up here. Put one right here. Okay. And here. Okay. And here. Okay. No, like I don't want it to block your vision at all, so we can skip that one. I'm going to enter in the final notes here. Extractions, no complications or complaints. Okay, so yes, you can have this done more than once. So we only recommend you come in once a week. We don't really want to do it any more than that because I don't think you'll see the full results. We'll be like extracting the formula we just put in if we do it more frequently than once a week. So certainly come back. You can schedule an appointment with the receptionist outside, and she will get you booked. Okay, it was great meeting you.